Welcome back our fans. 2. Thyroid gland. Thyroid gland is situated in the neck anterior to the trachea. It secretes calcitonin, of no apparent physiological significance in skeletal remodeling in humans. T3 and T4 activate metabolism and growth in all tissues, especially in the liver, muscles, heart and kidney. Thyroid hormones regulation, hypothalamic pituitary thyroid axis. Thyroid releasing hormone, TRH, is secreted by the hypothalamus to stimulate TSH secretion from the pituitary. Then, TSH stimulates the thyroid to secrete T3 and T4. T3 and T4 activate metabolism in tissues. When the level of T3 and T4 is elevated in blood, it acts as a negative feedback on the pituitary gland to stop further TSH secretion, and on the hypothalamus to stop TRH secretion. A. Hypothyroidism. Hypothyroidism is a deficiency of thyroid hormone. In infants and young children, it is called cretinism. In adults, it is termed myxedema. General manifestations of hypothyroidism. 1. Growth and mental retardation, in cretinism. 2. Intolerance to cold. 3. Fatigue and lethargy, lack of energy. 4. Dry skin. 5. Hoarseness of voice. 6. Depression. 7. Weight gain. 8. Bradycardia. 9. Hypotension. 10. Anemia. Oral manifestations of hypothyroidism. Specific for cretinism. 1. Delayed teeth eruption. 2. Enamel hypoplasia. 3. Class 2 malocclusion. All hypothyroid cases. 1. Thick lips. 2. Macroglossia. 3. Mouth breathing. 4. Gingival edema. Mouth breathing together with tissue enlargement increases the risk of periodontal disease. 5. Salivary gland enlargement. 6. Change in taste. 7. Burning mouth syndrome. Xerostomia increases the risk of caries. 8. Delayed wound healing. 9. Increased postoperative hemorrhage. Dental management of patient with hypothyroidism. 1. The dentist should detect and refer any patient suspected for hypothyroidism. 2. Definitive dental treatment should be delayed till the thyroid condition is controlled, euthyroid. 3. Diagnosed patients should be consulted for the susceptibility for cardiovascular disease and the need for antibiotic prophylaxis. 4. Patients may be on anticoagulants. 5. If the dentist is not certain about the cardiovascular condition or the level of thyroid control, the use epinephrine containing local anesthesia and epinephrine impregnated retraction cords should be avoided. 6. Hypothyroid patients are prone to respiratory depression, so the dental chair should be positioned semi-upright. 7. Respiratory center is hypersensitive to CNS depressants, narcotics, barbiturates, for example diazepam, and GA. So, they should be avoided. 8. The patient is at high risk of caries and periodontal disease. So, dental and periodontal prophylaxis is mandatory. 9. Povidone iodine is better avoided. Myxedema coma. Medical emergency occurring in untreated and elderly hypothyroid patients. Precipitated by traumatic surgery, infection, stress. Symptoms: hypoventilation, hypothermia, hypotension, seizures, bradycardia and heart failure, lack of consciousness. Management of myxedema coma. 1. Detection of the early signs of coma. 2. Immediate management. A. Call for ambulance. B. Drugs. I. 20 microgram T3/4 injection. 2. Prophylactic hydrocortisone 100 mg IM. 3. Empirical broad-spectrum antibiotics. C. Keep the patient warm. D. Oxygen and fluid supply, CPR if needed. B. Hyperthyroidism. Hyperthyroidism is elevated serum levels of thyroid hormones. Thyrotoxicosis is a term to describe the group of clinical features arising from high levels of thyroid hormones. Goiter indicates enlarged thyroid gland. General manifestations of hyperthyroidism. 1. Intolerance to heat. 2. Exophthalmos. 3. Tremors. 4. Irritability. 5. Weight loss. 6. Tachycardia. 7. Hypertension. Oral manifestations of hyperthyroidism. 1. Osteoporosis, high risk of periodontal disease. 2. High carbohydrate intake, high risk of caries. 3. Antithyroid drugs cause agranulocytosis, oral ulcers and high risk of infection. 4. Drug-induced sialoths, salivary gland swellings, xerostomia and pain. 5. Loss of taste. 6. Lingual thyroid nodule may be the cause of the high levels of thyroid hormones. 7. Difficulty swallowing. 8. Early shedding of deciduous teeth and early eruption of the permanent. Dental management of patient with hyperthyroidism. 1. The dentist should detect and refer any patient suspected for hypothyroidism. 2. Definitive dental treatment should be delayed till the thyroid condition is controlled. 3. Stress reduction protocol should be followed to reduce patient's anxiety. 4. Regular complete blood count should be performed to detect drug-induced lymphopenia and agranulocytosis. 5. Infection precipitates thyroid crisis. So, any acute oral infection must be dealt with urgently by antibiotic therapy and other conservative measures with consultation. 6. Hypersensitivity of the nervous system to epinephrine. So, epinephrine containing local anesthesia and epinephrine impregnated retraction cords should be avoided. 7. Aspirin and some NSAIDs should be used cautiously as they increase T4 levels and decrease antihypertensive blood levels. 8. Povidone iodine is better avoided. Thyroid crisis. Medical emergency occurring in untreated and elderly hyperthyroid patients. Precipitated by traumatic surgery, infection, stress. Symptoms: hyperthermia, fever, agitation and confusion, tachycardia, atrial fibrillation or heart failure. Management of thyroid crisis. Management of thyroid crisis. 1. Detection of the early signs of coma. 2. Immediate management. A. Call for ambulance. B. Drugs by medical professionals. I. Antihypertensives, propranolol oral or 4. 2. Antithyroid drugs to restore serum thyroid level. 3. Keep the patient cool. 4. Oxygen and fluid supply, CPR if needed. Thanks for watching. Support us by likes and subscribes.